This is FX Medicine. I'm Andrew Whitfield Cook, and we're at the 2019 UIC Medical Cannabis Symposium. I'm here speaking with Dr. Teresa Towpik. Now, Teresa, you've got a very interesting story.
Yes.
In that you didn't know or even like cannabis, like you thought it was just an illicit drug and that's it, correct?
Absolutely. Until January 2016, I thought it was simply just pot marijuana. Frankly, I didn't even know that it was cannabis. It was very foreign to me, and I was very ignorant about the medicinal use of cannabis.
And so when you say you had no knowledge of the medicinal use of cannabis, no patients came in espousing its virtues or anything like that, just no knowledge, blanket?
No knowledge, basically nothing. Yeah. Apart from this, the drug of addiction, gateway drug, dangerous and to be avoided. That's all that I knew about it, that's all.
Okay, and I would imagine you would have known well about the psychiatric issues, about, potential psychoses and...
Oh yeah, absolutely. To me it was, associated with possibility of schizophrenia, psychotic episode, and then like gateway drug, patients would start with marijuana, and because that's how I thought about it, marijuana, and then they would go, into heavy drugs such as heroin and so on. So you start marijuana, to me it was vicious. Your life is over. You become a drug addict.
Indeed, that's the medical standpoint of cannabis. So what was it that changed, and why were you so open to it?
Well, the turning point came in January 2016 when I heard that it was going to be legalized for medicinal use. And I was really very surprised because I never heard about such thing as medicinal use of cannabis. I simply became curious, so I went online and I started researching, looking for articles. And basically one thing after the other, I realized that how wrong I was. So I thought, how could I be so wrong? This is actually a very important therapeutic agent and really can help so many people. And what touched me a lot were the stories of patients, especially children with intractable epilepsy, and patients that their life changed because of using of cannabis. So that really touched me a lot. And then I realized that actually I can't be just a neutral bystander waiting for others to stand up and talk. I felt that it was important for me to continue educating myself and stand up.
That's a very proactive view, because most medical practitioners especially would say, that's my view, I will validate that view, I will rationalise that view, whatever new evidence presents itself can't be wrong, it can't be right, it must.
Look, I think my attitude might be slightly different because I went through cancer, breast cancer, about 18 years ago, and I embraced various forms of healing. So I think I came more from a compassion point of view, understanding that, if you see a little child who is experiencing between 50 to 100 seizures per day, and then after using and relying on many conventional pharmaceutical agents which are not controlling the symptom but creating adverse effects, and then you see the difference in that child, I think it's impossible not to embrace it.
What's been the evolution now of, I understand you're now involved in training other doctors?
That's right, yes. So in October 2016, I founded Medijuana, an organization which is focusing on science-based cannabis medicine, because I felt that it is important that doctors need to be educated, because that's how I changed my position. But also, in the beginning, my learning was very chaotic.
Right.
It was going from one article to another, Google this, Google that, and I felt really quite frustrated. So I felt we need something that would be a bit more structured, even just give me the introduction, give me the basic knowledge, and then from that I can build up. So that was the purpose of Medijuana, to provide this structured education about the medicinal properties of cannabis.
RACGP is usually a bastion of orthodoxy, though. Did you reach any brick walls, or were they pretty accepting?
Look, I was actually quite pleased with that introduction. At the time when we approached RACGP, we really had quite good interaction, and the team was actually quite excited about learning about medicinal cannabis as well. So I think maybe time was right for us. So I found our CGP team very supportive, and we have a great working relationship with our CGP.
Indeed, you say it was at the right time, indeed, because one of the big frustrations that doctors say is it may be legal through the SAS. A, it's a rigmarole, but B, what then? They don't know what product to give the patient. So how did you navigate that?
That's exactly right. So look, until March 2018, it was basically impossible for me to prescribe medicinal cannabis. But when the floodgates kind of opened, and then it became easier. I've learned everything about prescribing and how to approach TGA subscribing products basically by myself. So it was just a matter of putting application together, then TGA would come back with some question, I will come back with my answer, and so on. And through this process, I actually learned how to apply, how to provide clinical justification, and dosing and monitoring and management. With regards to dosing, I learned a lot from the article which was published by Dr. Russo, Dr. McCallum last year in the Journal of the European Internal Medicine. And they provided really quite good guidance, where to start, how to dose, what will be the maximal dose of cannabis. So I've learned all of it, and I'm just sharing my knowledge with other doctors.
And so if that was an American publication?
It was European journal.
European, okay. So European. So if you've got a plant grown in Europe and you've got a plant grown in Australia, there can be vast differences in constituents. How do you navigate that?
Look, basically we're dealing with standardized medicinal products. So my focus is to prescribe medicinal cannabis oil, which gives me the information exactly how much THC is in the formulation, how much CBD, and so on. So possibly regardless where the plant is grown, but it's highly standardized.
And what about the route of administration? You know, like you just mentioned oil.
Yeah.
Obviously the traditional modes of administration commonly used in America are things like vaping and even, good old smoking.
Smoking, that's right, yeah.
Or cookies for those people that might have a chronic pain issue.
Yeah.
Do you find that an oral dosing is more acceptable being a doctor?
Well, it is. So currently in a sort of Australian situation, the most common mode of delivery is oils, which are administered orally.
Yeah.
I like the oils because I usually ask patients to keep them under the tongue, which is becoming sort of sublingual, but I also like the oils because they allow me this careful and gentle titration. So I can, start very low and go slow. And let's say you start with a couple of drops and see how they respond. Every few days, you just add them a little bit more and so on. And then it also requires quite, good communication with the patient as well. So that cannabis medicine is very personalized.
Yeah.
And I feel very rewarded because I feel like I'm having good communication, good therapeutic relation with the patient. We work together. It is a teamwork.
Indeed, what you said is personalised medicine. This is something that the World Health Organization brought
Yes,
up.
yes.
That this is not just something that's nice, but it's vital.
That's right, yes.
So, Australian landscape, medical landscape, do you think we're working towards it?
I believe so, although, there are so many obstacles and perhaps it's not that easy, but I can see that I am an optimist, and I think there's a lot of criticism about it, and I appreciate it's not easy, it is difficult, but my experience since March 2018 is becoming more and more positive. I've approved, I applied for under special access scheme category B for 43 patients and 100% approval. So I just learn how to navigate the system, how to, communicate. And then I am now authorized medicinal cannabis prescriber.
So 5 different ways I want to go here, but the first question I just want to get out of the way is March 2019, there's been recent proposed changes to guidelines with regards to how integrative medicine, emerging therapies and stem cells are regulated in Australia. This was proposed changes by the Medical Board of Australia.
Yeah.
What do you think of this?
Well, I wouldn't agree with that. I think obviously as a doctor and judicially responsible, I agree with some regulation because we want to make sure that patients have access to safe treatments. But at the same time, as a patient, cancer patient 18 years ago, I also believe that we have the right to various forms of treatments and various healings. And I really strongly believe in integrative medicine, and we should have the best of different approaches, modern medicine, but also ancient traditional techniques as well.
And what about a doctor normally being used to a single entity, single drug in a tablet or a dose? What do you feel about the notion of full spectrum products versus the just CBD, just THC,
Yeah. Look, I highly believe in the concept of whole plant medicine. And we need to change the way we're thinking about medicines because in the beginning of 20th century, pharmaceutical companies started introducing single molecule synthetic agents. And we doctors were trained to rely on them as effective, safe, evidence-based, and we were trained to look down on plants and medicine as inferior. So that has been a bit of a brainwashing, I believe, and we really need to change our attitude. But also, medicine is an art. You can't be stuck in just one worldview. Or just one approach. You have to be open-minded and curious. And let's say if a patient comes to you and they say, look, I feel so much better by, for example, juicing cannabis, instead of saying, no, it's not true, I would be curious and ask them, how does it work for you? What is happening? We have to cultivate that curiosity, open-mindedness, and compassion.
We can only hope that more doctors will take your approach. But I also want to ask you a last question. That is, you've now taught other doctors about your experiences using the SAS scheme paperwork, rigmarole, which a lot of doctors say that it's just too much rigmarole. They're really busy. And so therefore they won't do it. Do you feel that maybe it's because they don't have the confidence to approach it, and so therefore it becomes a too hard basket? What's been the experience of doctors that you teach?
I think we're making assumptions that this is too hard without even trying. The process, although not, still a bit complicated, but is becoming easier. There's online portal now for doctors in New South Wales that you just single application. And once you do free application, it's really not that hard. Last year, it used to take me a few hours to complete the application, and I spend a lot of time my weekends and after work. Now, it may take me about 10 minutes. Although I believe that the process should become even easier. I'm hoping to see time that we'll be just writing the script, going to the chemist and picking up your medicine.
And therefore, the issue comes up of cost. What's been those hurdles? What have been those
look,
hurdles?
Absolutely. The problem is that it is too expensive. It may cost anything between $200 to $500 per month for patient. Majority of my patients are, low income earners, healthcare holders, or pensioners. So the cost has to come down. It is at this stage too expensive.
Do you find that some of the products that are legally available are cost prohibitive, and so it does drive patients to the black market?
Yeah, on a couple of occasions, unfortunately, my patient, even though they benefited from legal product, they told me, look, I just can't pay that much money. I can go to these people and it cost me just $50, $60 per month.
And then what was their experience from a patient perspective? Did they get as much benefit as if they would have gotten from
they comment that the legal product is actually better or very higher quality. And I'm concerned that when they go to black market, they miss out on a proper medical advice, management and monitoring, and sometimes they miss the diagnosis. For example, I had the case of a patient who thought he was treating pain in his knee with some cannabisol, and it happened to be a clot in his leg, which required totally different treatment. So we can't really bypass a proper medical medical examination, assessment, and clinical decisions.
So it really is critical that we get an easier access for patients so that
Absolutely.
they can get a better medicine
Absolutely.
at a better cost.
Yeah, definitely. But look, I also believe that cannabis may give us the opportunity to reduce the cost of the health system, because we can reduce polypharmacy. We can, by improving health in the community, we may have a chance to reduce the number of hospital admissions. We can also reduce the number of interventional procedures such as cardiac bypasses or joint replacements. But also I'm observing that the patient, their functionality is improving. Some of them are able to go back to work. So we can reduce the reliance on welfare payments. So if we do it properly, I think the benefits may occur on many levels.
Dr. Teresa Towpik, I thank you so much for
Thank you
your
very
open mind
Thank you.
and for sharing your experiences today
My
on ethics
pleasure.
medicine. And I give a call out to any doctor out there that just have an open mind and contact United in Compassion and Dr. Teresa Towpik and become educated. This is FX Medicine. I'm Andrew Whitfield Cook.